Dr. Michael Ozner is one of America's leading advocates for heart disease prevention, and he's with us here just now. How are you doing?
Good, good. Thanks for having me, Toby.
Yeah. Now, you've got a new book called Heart Attacks Are Not Worth Dying For. Can you tell me a little bit about your approach to preventing heart disease?
Yeah, so basically, my new book was, I wrote this book to bring a new approach to heart disease prevention. And the reason for that is if you look at the statistics, we know that heart disease, and specifically heart attacks and even strokes, which we call cardiovascular disease, are the leading cause of death for men and women, not only across the United States, but worldwide, with an annual death rate of over 800,000 people in the United States alone, and over 18 million people worldwide, with an annual cost in the U.S. of greater than $500 billion a year. So basically, a lot has changed in our ability to battle this disease, which again is the leading cause of death worldwide. And so the first question is, what causes heart attacks and strokes? What is it in the blood vessels that we really have to look at and treat so that we don't succumb to this disease? And the answer is right before you, and that's these lipoproteins, which are round spherical structures, particles that are packed with cholesterol and triglycerides, and they flow through the bloodstream. And so we can measure the number of these lipoproteins by get an estimate of how many of these particles there are by measuring a test called LDL cholesterol. A lot of people call that the bad cholesterol, but that's readily available. It's inexpensive to measure that. And to give you an idea of how the process works, I'm going to show you a very quick video that kind of summarizes it. And you can see coursing through the artery are these yellow particles. Those are those lipoprotein particles. And you can see if there are too many of them, they end up going into the artery wall, and purple cells are inflammatory cells that then gobble up these cholesterol-packed lipoproteins, and they end up developing what we call an atherosclerotic plaque. And that's a fancy word that means a collection of cholesterol and fat in the artery wall that's like a pimple in the artery wall. And the problem is that once this is there, this can rupture if it gets highly inflamed. And when it ruptures, it can form a blood clot that then shuts down blood flow through the artery. And we get a heart attack if it occurs in the heart. If it occurs in an artery in the brain, we get a stroke, and so on. So basically, despite our focus and emphasis on healthy lifestyle choices and medical therapy and interventional procedures like bypass surgery and stents, heart disease, unfortunately, remains unacceptably high, the death rate. So what I'm saying is what we are doing is simply not working. And I love this quote by Albert Einstein, who said that insanity is doing the same thing over and over again and expecting different results. Well, that's what we're doing. And we need to have a new approach to not only treating, but especially preventing this disease. So we need to become proactive and prevent this disease rather than reactive and wait for this disease to strike and try to bail out patients that are in the throes of a heart attack or a stroke, and often we're not successful at doing that. Let's become proactive and prevent this disease. So we are at the dawn of a new era in heart disease treatment and cardiovascular medicine. And this is now I have really been in the trenches of looking at ways that we can beat this disease for the last 3 to 4 decades. And I could tell you that we now have a new paradigm shift, which it's time to consider intensive cholesterol lowering to stabilize, to shrink, and to eradicate or eliminate these atherosclerotic plaques that I just showed you, and thereby eliminating the risk of developing heart attacks and strokes later in life. So starts with this LDL cholesterol that I mentioned, and what's the optimal level? What should people have when they get a blood test? And the optimal level of LDL cholesterol is between 50 and 70 milligrams per deciliter. Well, the average American and the average person around the world has numbers double that. So
Wow.
they're nowhere near what we consider to be optimal. And it's no wonder that this collection of cholesterol carried to the blood vessel wall by these particles is creating these plaques, which then rupture and lead to major catastrophic problems. Well, can we reverse this? Can we take an atherosclerotic plaque and cause it to go away? Well, the answer is yes, and this has been shown many times in the clinical literature. Here's one example of a patient who on photo A has narrowing of the artery in the heart, which we call the coronary artery, that you could see, and then placed on intensive lifestyle treatment, and you could see in B that narrowing goes away. The plaque is eliminated. And that's really what we're aiming for. So how are we able to achieve that now? Well, we now, I like to say, have new arrows in our quiver to lower LDL cholesterol. And if you look at medications that we've had in the past, it's only really been statin medications. A lot of people have heard of statins. Been around for decades. And statins are fine, but the problem is that statins only lower cholesterol to a small degree, relatively speaking, and it basically roughly 75% of people taking statins still go on to have heart attacks. So we now have developed new medications that you're seeing here. I'm not going to go through all these new medications. I talk about this in my book, and I talk about an approach that we could utilize lifestyle and medications as needed to defeat and eliminate this disease. The other question that comes up is, when does this disease start? And believe it or not, it starts in childhood with very early atherosclerotic streaks. And then in young adults, we see full-blown atherosclerotic plaques that I showed you. Here was a study performed looking at soldiers who were killed in action in the Korean War. The average age was 22 years old. And on autopsy, nearly 80% of these young recruits who unfortunately were killed in action had evidence of these atherosclerotic plaques. So it's, I like to say, it's following the toxic diet and lifestyle we lead is what is a major cause of our cholesterol shooting up and leading to this. And of course, we now have new developments and new ways of eradicating this disease so that we can reset our vascular aging clock and eliminate this disease. And the way to do it is by eradicating early atherosclerotic plaques before they become more advanced, highly inflamed, and leading to rupture and major events like heart attack and strokes. So the future is to take our risk factors off the table. And what are the major risk factors? There's poor lifestyle, a poor diet, lack of exercise, stress, cigarette smoking, poor quality sleep, treating hypertension, high blood pressure, getting that normalized, treating inflammation. A lot of people who walk around with inflammation of the gums, periodontitis, and other inflammatory diseases throughout the body, that increases the risk of heart disease. Diabetes does, so does obesity. And we have an obesity epidemic not only in the United States, but around the world. So taking these risk factors off the table and then controlling these LDL particles that I showed you is the winning strategy, because to control LDL cholesterol with a healthy lifestyle and safe, highly effective medications that have been well studied in the scientific literature as needed to stabilize, shrink, and potentially eradicate or eliminate existing atherosclerotic plaques And also, this approach will prevent new plaques from forming. So as I see it, we've got two pathways to go down in our quest to live a healthy life. One I call the dead-end road. And the dead-end road is just keep doing what we've been doing. And it doesn't work. It certainly leads to premature death, and certainly people that are often taken in the prime of their lives. Or we could walk down progress road. Progress road means following a healthy diet, a heart-healthy diet, getting regular exercise, avoiding stress and cigarette smoking, and all those things that we talk about in healthy lifestyle, and then get biomarkers. These are blood tests like I talked to you about with LDL cholesterol, and see where it is. If it's too high, we have ways with, we always start with lifestyle, but if you're not at the level that you should be and you're getting plaques developing because of that, we have ways to lower your LDL cholesterol to levels that we heretofore have not been able to achieve in the past, but we can achieve now, so as to eliminate those atherosclerotic plaques. We don't need to be on these medications for life. Once we eliminate them and once we get them down, we can then maintain this with a healthy lifestyle and perhaps just statin medications if it's needed, and reserve the very potent medications for those people that develop these atherosclerotic plaques, and we can eliminate them. This is a very similar approach, I might add, to what the gastroenterologists do by doing colonoscopy and removing polyps that could be cancerous. And once they remove them, they then will wait another 10 years and then look and see whether or not there's a problem developing and then remove them again. Well, I say we should start removing atherosclerotic plaques with an approach that I outline in my book. And I certainly go through a straightforward approach of how people can follow this path to eliminate atherosclerotic disease, to eliminate the risk of heart attacks and strokes, and to live a long, happy, and heart-healthy life.
Yeah, absolutely. So heart attacks, are they the most common death in the world then?
Yes, they are. Heart attacks clearly are the most common cause of death, and it dwarfs other causes of disease. Now, again, the same process that can cause heart attacks can also cause strokes. That's why the term cardiovascular disease is used. But it's mainly heart attacks, and we need to decrease the number of heart attacks that we're seeing and eliminate them, not only in the United States but all around the world, both in developed and not undeveloped countries. And I think that we're there, and we are able to do that with the approach that I've described.
Yeah. And it's not just heart attacks as well, I suppose. I think that all the things that a person can do to stop the risk of having a heart attack also prevents all sorts of other bad diseases, right?
Toby, that's an excellent point, and I'm glad you brought that up, because you're right. And it's the beauty of all of this is that this same approach of living a healthy lifestyle and decreasing inflammation and lowering blood pressure also reduces the risk of other diseases like cancer, like autoimmune diseases. And I could go on and on. So it really is a way of healthy living. Mm-hmm. And honestly, I believe that people who follow this type of approach, again, can lead a long, heart healthy and overall healthy life.
Yeah. And you, as a doctor, have you written any other books before, or is this something that you have kind of moved into and wanted to do that's different from normal?
No, I've been in the trenches of prevention and clinical research and patient care for decades of my life, and I have written a number of other books. One is called The Great American Heart Hoax. Another is called Heart Attack Proof. And a third book I wrote, I got very interested in nutrition. I'm a believer in the Mediterranean diet. because of all the clinical science that is associated with a Mediterranean diet to decrease the risk of heart attacks, decrease the risk of inflammation, decrease the risk of decreased blood pressure, and a whole sort of things that a Mediterranean diet can do. Yeah. But remember, it is really sometimes we have to take genetics into play, because some people, even if they follow a heart-healthy lifestyle, may still have an increased LDL cholesterol because they were born with the various what we call mutations that allow them that cause high LDL cholesterol. Well, now we can do something about that. So even if somebody is doing all the right things, but they still have an elevated LDL cholesterol, we can now treat it. Before where our hands were tied, where a lot of people, we wanted to get to goal and we couldn't.
Yeah, that's quite interesting. And do you find it quite easy then to write these books, considering you've written a few? Is that writing a kind of natural thing to you?
Well, it is. And to be honest with you, medicine is always changing.
Yeah.
And I like to say changing for the better. We, over the past, I would say, decade, through what we call genomics, genetic engineering, have been able to find ways that we can lower the root cause of heart attacks, those particles that I showed you. Yeah. And it was through genomics and genetic studies that we're able to now have medications that have been tested for almost a decade. Wow. And have been shown to be safe, because that's very important. You know, you have to have not only highly effective medications, but safe medications. So, yes, medicine is always changing. And I find that now we are really, for the first time, truly at a point where we could take this disease, heart disease and heart attacks, which is like the ferocious lion, and reduce it to a harmless pussycat.
Yeah. And one thing I want to bring up as well, what are the main symptoms of a heart attack? If somebody is about to have one, what should they be looking out for?
Well, you know, the classic symptoms of a heart attack, and by the way, this occurs not just in men, but men and women. So the classic symptoms are a tightness in the chest pain, which often radiates to the jaw or down the arm, and it's usually associated with people having shortness of breath and breaking out into a sweat and feeling like there's an elephant sitting on the chest. Now, having said all of that, we see all different types of presentations. Yeah. We see people who may not have chest pain. They may have extreme fatigue or shortness of breath. We have people who think they have a dental problem because they have jaw pain. So the bottom line is, if there's any suspicion in cardiology and in medicine, you're guilty until proven innocent. You should get checked out to make sure that you're not having a heart attack. And I think that's a very important point.
Absolutely. Well, if we're interested in preventing a heart attack, so that doesn't happen, where are we able to find your book everywhere if we want to read it?
Well, it's on all the major bookstores, including Amazon, and you could just look up my name, which is Dr. Michael Ozner, O-Z-N-E-R, or the title of the book is Heart Attacks Are Not Worth Dying For.
Yeah.
And again, at the end of each chapter in my book, what I've done, because the last thing I wanted to do is write a heavily scientific book that people couldn't understand. So I make it very readable. And at the end of each chapter, there's 14 chapters, I have the key points that people should know. Yeah. So it's really an easy read, and I want to make this simple so that people can not only allow themselves to live a long, healthy life, but people also want their children to live long, healthy lives. And I think that, remember what I said, that this disease actually starts in youngsters. So we should institute our lifestyle changes early on. And for those people that when they get into early adulthood, who develop these atherosclerotic plaques and high LDL cholesterol levels, we now have the tools to be able to do something about it. And that's a very powerful statement. And I think as a result, I'm very confident that going forward, not only in the United States, but around the world, we will see a significant decline in cardiovascular disease, namely heart attacks and strokes.
Yeah, that's a good way to structure it, because most people reading it aren't going to be doctors or experts, so they want it really simple and a reminder of what they've just read as well, I suppose.
That's right. People really want their doctors to provide them with a pathway to good health.
Yeah.
They don't want to be sitting there, with having to try to figure out what an atherosclerotic plaque is. They want, the ABC, the 1, 2, 3, and it couldn't be any more straightforward and easy in my book. As I said, at the end of each chapter, I have key points that are understandable. And I think that everybody should have a personal treating doctor, physician, who they can sit down with and have a prevention plan before they get sick, before they get a heart attack. And I think that's the winning strategy. And they could read this book, and therefore, when they go to see their healthcare provider, their doctor, they're armed with the information. They know what questions to ask. They know what they need to what things they need to do. And, unfortunately in medicine today, it's often patients tell me that, they'll go to an office and, it's so crowded and they only have 5 minutes with the doctor and nobody has time to sit down and talk to them about a prevention approach, a prevention plan. So for those people, I say, read the book, be armed with the knowledge. Knowledge is a very, very important thing. And then when you go see your doctor, have your questions written out. You want to know what your LDL cholesterol is. And there are other factors in the blood that we test for, which I talk about in the book. Know what they are. And if your doctor is unwilling to spend the time to be able to discuss this with you, then my suggestion is you might want to look for a doctor who is going to sit down with you and create a prevention strategy for you. In fact, in cardiology, we have a field now called preventive cardiology. And these are doctors like myself who are passionate about prevention of the disease rather than waiting for this disease to strike. And I would recommend to everybody, you truly want to prevent this disease, because once it strikes, it's unfortunately a lot of people don't even make it to the hospital if they have a heart attack or a stroke. And those that do, their life is never the same, and it's very expensive and costly. So I say the better approach is learn how to prevent this disease. And that's my driving force as a preventive cardiologist for writing this book.
Yeah, absolutely. That's very interesting. Well, thank you very much for coming on the show today. It's been great talking to you.
Thank you very much, Delby. I certainly appreciate it.